Oh, all right. Thank you very much. That's great. Okay, so this is just to summarize the study. We saw a lot of this. So the planned sample size was 114, and notice that it wasn't one-to-one randomization. We had different numbers here. Any comments on that? Unequal randomization? Okay with that? Why did they do that?
More patients on the active arm.
Okay, that's yes. They wanted more patients on the active arm, right? That's the reason they did it. Any issues about that? Well, remember, it's less efficient if you do that. To show the difference against control, the most efficient is actually 50-50. So they actually would have lost a bit of power by doing that. They did that. 81% power? What do you think about that? Why do you think it's 81% and not 80%? Doesn't matter in practical terms, but why do you think they reported that? I think they're just being clever. They're just showing you that they can calculate it exactly, and of course it's you have to have a whole number of patients, so you're always going to get never an exact power value that you want. It's going to be something close. So take the closest one. It's probably the first sample size over what you require of 80%, I presume. One-sided testing? What about that? It's a superiority trial, so they could have done two-sided. Yes, but did they have to use two-sided? No, not really. No. What they're doing by one-siding is ignoring the possibility that the intervention is worse. They're saying that that couldn't possibly happen, or at least that they're not interested if it happens, which is a bit surprising. Personally, I would always use two-sided if there's any doubt whatsoever. Be a bit more conservative. It takes a few more samples, but that's certainly what I would do. And the design treatment effect was 25% in terms of the number of people who responded a certain number of points on their scale, on their depression scale. Okay, so that's the basics. And then somebody asked about the conditional power. So this was actually one of the papers that we worked with, where you could actually take out the original data and do the conditional power calculation. So here it is. Here's the conditional power result, second line there. So assuming the current trend, you get very low conditional power, less than 1%. Why is that? Why is it so low? Why have you got almost no power left under that hypothesis, under the current trend? But what's the current trend? What is the current trend? There's no difference. very, very small difference. So the current trend hypothesis is that will continue, and what's the probability now of a significant result? Almost nil, almost nothing. But what about the design hypothesis? Conditional power is about 35%, so you're still in there possibly. Okay, so once again, it's that big difference in conditional power depending on what hypothesis you assume. So now this is a study that stopped for futility. So this could be a random low by bad luck, depressing bad luck. They happen to have this happen, and the treatment perhaps is better than it looks in this early stage. So we're going to have underestimation of the true effect. Anytime you stop for futility, it's going to be underestimation of the true effect. By how much? Quite a bit. Even under the current trend, even more so under the design effect. It's going to be underestimating it. This is now hypothetical, the rest of it, I think, looking at what might have happened with the same setup in this particular trial. So this is the expected effect at the interim analysis if the study is stopped under the protocol as it was designed. So you would expect to see a 3% difference in studies that stop, and it was actually less than 1%. So it was very small and close. But if if the design hypothesis was true, you would actually have to have a much poorer result in order to stop. You'd have to be even more unlucky if the design hypothesis was true. If there really was an effect, you have to have even more bad luck for it to stop with showing no effect at that point. Okay? Probability of stopping, under the current trend, it's actually not that high, it turns out. So even with a very small effect, only a 7% probability of stopping, but they did decide to stop. Under the design hypothesis, it's almost never going to happen. So that's saying if the original protocol was absolutely correct, that there was a, what was it, the planned effect of 25%, if that was really true, you would hardly ever stop. The results would carry you forward and you'd find a positive result. So obviously the actual results are very much in conflict with what was assumed at the beginning. And then this is the effect overall at the final analysis if you complete the study. So 25%, 25.8, 25.1. So underestimation, but very small. So there's a very small bias overall in these studies if they keep going. And the main concern is therefore the underestimation here. So the decision was made to stop, and we recognize that under these two possibilities of essentially no difference, or in future data, or the design effect, that we actually have substantial underestimation of the effect. So I would look at that figure and sort of discuss whether you think it's worth going on with about a 1/3 chance of a significant result still. Or whether you become a Bayesian and you use the information as you have it now in conditional power based on what you've seen so far, tells you to stop. That's the big dilemma. What do people think? What would you think? What would you do if it was your study? There's no right answer. You can't be wrong. Okay, show of hands. Who would stop? 1, 2 people, 3 people, 4 people. Okay. Who would carry on? Okay, slight majority. Who didn't vote? Lots of people. Okay, slight majority for carrying on then. That seems to be the message. But these people did actually stop. You'd obviously have to consider other factors, like your expense, side effects, and all of those things. But based on this, it's a kind of borderline decision, I think. Okay. I think that's all I have to say about that study. I don't know if anybody wants to add anything from...
Actually, we should also think about their outcome variable, whether that is really sense they say some ACR 20 criteria.
Yes.
That is that
Okay, so in case others didn't hear, the question is, maybe you need to think about another outcome variable instead of the ACR 20 scale? Yeah, sure, but that's changing the question.
initially when they
Oh, initially.
whether they use the proper outcome.
Okay, so you're questioning whether it's the best outcome to have used. Yes, okay. So I suppose the argument might go that if you think that scale is not the best to represent the effect that you're anticipating, you might be more inclined to carry on because there'll be some effect on that scale, but perhaps not the perfect one. That would actually be an argument. Even though it's not the best measure, that would actually be an argument to continue rather than stopping. I would be very reluctant, though, to say, let's look at something else as the main outcome. I don't think you can change the rules now. You're stuck with it. Okay. Any other comments? Okay. Okay, well, in that case, I think we're done. Hand over to Jai for